All right, so let's dive into something pretty major, something that could actually directly affect your health. We're talking about Robert F. Kennedy Jr. And yeah, that Kennedy, yeah, the one with the famous family, he was just confirmed as the head of Health and Human Services. That's a big deal.
It's huge.
Why? Well, because this position oversees, I mean, think about it, the FDA, the NIH, the
Us.
CDC.
Basically, any agency that has a say in your health.
Yeah, exactly.
Right.
They decide what we eat, what medications we can get, what health information we even see.
It's a lot of power.
Right. So in this deep dive, we're going to explore, well, what could this new leadership mean for all of us? You know, based on everything we know about Kennedy's views and plans,
Yeah.
is Make America Healthy Again actually possible, or is that just a catchy slogan?
Well, to understand that, we should probably start with his background. RFK Jr. is a lawyer, an environmental lawyer, to be specific.
Right.
And he doesn't have any medical background, but he's definitely using his family name to his advantage.
I mean, that name carries a lot of weight. You can't deny that. And he's running on this Make America Healthy Again platform, which honestly sounds pretty good to a lot of people, taking on big pharma, tackling what he calls the disease of isolation by focusing on community.
Yeah, he's tapping into some real concerns that people have. I mean, who isn't worried about rising drug costs or
Yeah.
feeling like the healthcare system is failing them?
Yeah, for sure.
But we need to ask ourselves, are his motivations genuine, or is this just clever politics?
It's a good question, one that each listener needs to consider. But to really understand the potential impact, let's look at some specifics. One area where you might see a direct impact is food. Kennedy has strong opinions about what we eat, especially when it comes to things like the Supplemental Nutrition Assistance Program. You know, food stamps and school lunches.
What's interesting is he's actually criticized these programs for prioritizing ultra-processed foods and sugary drinks. That's a direct quote.
Right.
He wants healthier options.
Which sounds great in theory.
Absolutely.
Who doesn't want healthier food?
Right.
But things are usually more complicated than that.
Exactly. There are always trade-offs. Could this lead to better nutrition for families who really rely on these programs? Maybe.
Okay, so maybe.
But then there's also potential downsides. Will it be harder for people to access food? Will it create more bureaucracy and red tape for people who are already struggling?
These are all really important questions to think about. And of course, we can't forget the big one, the issue that everyone's talking about, vaccines. This is where things get really controversial.
Definitely.
Kennedy says he's not anti-vaccine, but pro-safety. He wants more transparency about how well vaccines work and their side effects. He claims there aren't enough safety studies and that we need better ways to track the effects of vaccines.
And that's where his views clash with the vast majority of scientists and doctors. The general consensus in the medical community is that vaccines are safe and effective.
Decades of research point to that.
Yeah, exactly.
But Kennedy's skepticism, it's contributed to a lot of vaccine hesitancy,
Right.
which can have serious consequences for public health.
Absolutely. It raises the question, is he really trying to improve vaccine safety? Or is this a dangerous platform built on misinformation?
That's the million-dollar question,
Yeah.
because the impact on public health could be huge.
It's definitely something we need to be aware of.
And it's not just medical professionals who are concerned. Senator Mitch McConnell, a polio survivor, voted against Kennedy because of his stance on vaccines.
Wow.
Yeah.
So this is clearly a bipartisan concern.
Yeah, it sends a strong message.
But here's something else to think about. Despite all the controversy, Kennedy did receive serious commitments from the White House.
Interesting.
So what does that tell us about the political dynamics at play? Who's really calling the shots?
It's like we're in a political thriller, but with our health hanging in the balance. Like one article in The Atlantic put it, America's health is in the hands of an anti-vaccine conspiracist.
Yeah.
Strong words.
Yeah.
It really makes you think about what the future holds.
Definitely does.
Yeah, it is kind of scary when you think about it. And while we can't predict the future exactly, we can look at his plans and try to figure out what they might mean for us.
Right.
Okay, so we talk about food assistance programs and vaccines, but those are just two things. Kennedy has a much bigger vision for making America healthy again. And some of his ideas, they could have a huge impact on the entire healthcare system.
Yeah, like the FDA, for example. They're the ones who approve new drugs and medical devices.
Right.
So what happens if Kennedy's skepticism of big pharma influences those decisions?
Oh, that's a good point.
Could it slow down the approval process for important treatments?
Yeah, that's a really scary thought. And what about research funding?
Yeah.
The NIH funds a ton of medical research, everything from cancer to infectious diseases.
Yeah.
Could Kennedy's focus on alternative approaches Mean less funding for those critical areas?
It's possible. And remember, Kennedy is the face of public health in America now.
Right.
What he says has a lot of weight. And if he keeps questioning vaccines or promoting unproven health claims,
Uh-oh.
it could really damage public trust in science and medicine.
And when people don't trust the healthcare system, they're less likely to follow medical advice or get vaccinated or even seek treatment when they need it.
Exactly.
That affects everyone's health.
It really does. That's why it's so important to be informed. You need to be a discerning consumer of health information.
For sure.
Don't just take things at face value, even if it comes from someone important.
Right.
Do your research. Talk to your doctor. And be critical of what you see and hear, especially online.
Especially online. And remember, you have a voice in all of this.
Yeah.
This is about your health, your family's health, your community's health.
Absolutely.
If you're worried about the direction things are going, speak up.
Exactly. Contact your elected officials. Share accurate information with your family and friends. Engage in discussions online. Be part of the solution.
Be part of the solution. That's a good way to put it.
Yeah.
This isn't just about RFK Jr. It's about the future of public health in America
Right.
and the decisions we make today. They'll affect us for years to come.
So what does this all mean for you, the listener? Well, you can't just sit back and do nothing. You have to be actively involved in shaping the future of your health.
Be informed, be vocal, and be proactive. Because when it comes to public health, we're all in this together.
We are. And that brings us to a final question for you to think about. So with RFK Jr. at the helm of such a powerful agency, what role will you play in shaping the future of public health? Are you going to be more engaged, more informed, more vocal?
It's a really important question.
This deep dive is just the beginning.
Right.
It's a chance for you to start asking questions, do your own research, and decide how you want to respond to all of this.
I like that.
It doesn't have to be anything huge. Maybe just talking to your family about vaccines, or being more mindful of what you buy at the grocery store.
Those are great first steps.
Or maybe you want to do more, like getting involved with local health initiatives, or contacting your representatives.
There are so many ways to make a difference.
The point is you have options.
Yeah.
And your health. And the health of your community is
Wow.
worth fighting for.
Absolutely.
Sometimes that fight starts with a simple conversation.
Yeah.
So keep those conversations going. Stay curious, stay informed, and stay engaged.
Because in the end,
Yeah.
we're all in this together.